And we've been trying to make contact with some officials in government to respond to this issue of the lack of PPEs. We have been unsuccessful so far. But joining me via Skype now is the Deputy General Secretary for the Ghana Medical Association, Dr. Beyuo. He's also a member of the Infectious Diseases Committee of Ghana. Thank you very much, Dr. Beyuo, for making time to speak with us. Now, what is the challenge with the availability of PPEs to health facilities from where you sit?
Good evening, and thank you for having me. Good evening to our viewers. From where we sit, we keep getting complaints from the health facilities, especially the emergency point in some of the hospitals and polyclinics, that they do not have the adequate numbers of the PPEs. And simple things like surgical masks, the N95 masks, and some other PPEs are not reaching there. And I think we have had concern to complain of this to the ministry. And I think that is one of the reasons why they launched the number that frontline workers should call. So I'll encourage everybody to give that feedback so that the ministry will know that that is really the reality on the ground, because a lot of complaints we are getting across the country is showing that where it is needed most, there do not appear to be enough of the PPEs.
All right, you talk about where it is needed most, but we know about the issue, or that the most critical place where these PPEs are needed will be the treatment facilities. Do the treatment facilities or treatment centers have the same challenge?
For the few that we have checked, the treatment centers don't appear to have that challenge. But from the medical point of view, we think in as much as the treatment centers need it, the emergencies need it even more. And this is so because at the treatment centers, if you're a healthcare worker, it's perhaps one of the safest places to be. Because at the treatment center, the diagnosis is confirmed. You know you are dealing with a case of COVID-19. You go in with all the necessary precautions. Now, at the emergency centers, you have people coming in that you do not know who has it and who do not. And that is when I think we need protection. That's when health workers are most vulnerable. So if you walk into the emergency of Rich Hospital, Kolebu Teaching Hospital, the 37 Military Hospital, any polyclinic, these are the places where most people will first report to. And this is where the diagnosis will be made before the patient is sent to the treatment center. So as much as it's important to make sure that the treatment centers have the PPEs, it is equally important for the safety of the healthcare worker to ensure that the minimum required at the emergencies and outpatient departments is also available.
You make a great point, Dr. Beyuo, but I am just imagining that could it be that because there aren't enough PPEs to go around, the authorities are deciding that let's take care of the treatment centers first, prioritize the treatment centers, and then make some available later for these other health facilities, which are also frontline and also need them?
That is not the indication we are picking up. Because when we speak to the interministerial team members and the response team, what we hear is that they have deployed as many PPEs as possible. But when we get to the ground, the story appears to be different. I do not think that if you look at the number of treatment centers we have, they are not enough to consume over the 10,000 or 5,000 PPEs that have been distributed. And PPEs like the simple surgical masks or N95 should be available at all the emergencies. So there appear to be some missing link between the distribution and its final availability to the health worker at the front line. And so we would use this medium to appeal to all managers of the system, heads of various facilities. If they have received these things, indeed, they should make them available. If they haven't, then they should make the necessary report to make sure that our health workers are safe. It cannot be that we would send all the PPEs to the treatment centers. If you take a treatment center like Rich Hospital, it has only 4 beds. And so, but people have to make the diagnosis and bring the cases there. If you take the Gan East, that is where the beds are more. And I do not think all the PPEs have been sent there. So definitely there must be PPEs at the emergency units. If not, then we are jeopardizing our fight, in the sense that if these health workers who will help make the first diagnosis get exposed, very soon we will not have enough of them to cover the emergencies. And then when we really get higher number of cases, we will struggle to cope in terms of human resource.
All right. Thank you very much, Dr. Titus Beyuo, and he is Deputy General Secretary of the Ghana Medical Association. Back.